Fibroids and endometrial polyps are both common gynecological conditions that can affect women of reproductive age. While they share some similarities, such as their location in the uterus and potential for causing symptoms, they differ significantly in their composition, growth patterns, and clinical implications. This video will delve into the key distinctions between these two conditions, providing a comprehensive understanding of their unique characteristics and potential consequences. Please like, share, and subscribe. Composition and structure. Fibroids are benign tumors composed of muscle and connective tissue. They can vary in size from small, pea-sized growths to large masses that can distort the shape of the uterus. These tumors can develop anywhere within the uterine wall, including the submucosal layer, intramural layer, or subserosal layer. In contrast, endometrial polyps are growths that arise from the endometrium, the tissue that lines the inside of the uterus. They are typically smaller than fibroids and often appear as small, fleshy growths. Growth patterns. Fibroids can grow rapidly, especially during pregnancy or in response to hormonal changes. Their growth can be influenced by factors such as estrogen levels and genetic predisposition. Endometrial polyps, on the other hand, tend to grow more slowly and are often discovered incidentally during routine pelvic exams or investigations for other symptoms. Symptoms and clinical manifestations. Both fibroids and endometrial polyps can cause a variety of symptoms, including heavy bleeding, irregular menstrual cycles, pelvic pain, and infertility. However, the specific symptoms and severity can vary depending on the size and location of the growths. For example, submucosal fibroids, which protrude into the uterine cavity, can cause heavy bleeding and infertility. Endometrial polyps, particularly those that are large or obstruct the uterine cavity, can also lead to abnormal bleeding and fertility issues. Risk factors. Several factors have been implicated in the development of fibroids and endometrial polyps. These include hormonal factors. Both conditions are thought to be influenced by hormonal factors, particularly estrogen. Women with high levels of estrogen may be at increased risk. Genetics. A family history of fibroids or endometrial polyps can increase the risk of developing these conditions. Age. Fibroids are most common in women in their 30s and 40s, while endometrial polyps can occur at any age but are more common in women after menopause. Obesity. Obesity has been associated with an increased risk of both fibroids and endometrial polyps. African American ethnicity. African American women have a higher risk of developing fibroids compared to women of other races. Diagnosis and treatment. The diagnosis of fibroids and endometrial polyps typically involves a combination of physical examination, pelvic ultrasound, and sometimes additional tests such as MRI or hysteroscopy. Treatment options for both conditions depend on the severity of symptoms, the size of the growths, and the patient's desire for future fertility. Fibroids. Treatment options for fibroids include observation. Small asymptomatic fibroids may not require treatment and can be monitored with regular pelvic exams and ultrasounds. Medications. Hormonal medications can help shrink fibroids and reduce symptoms in some cases. Myomectomy. Surgical removal of fibroids without removing the uterus. Hysterectomy. Removal of the uterus, which is often considered for women with severe fibroids who have completed childbearing. Endometrial polyps. Treatment options for endometrial polyps include observation. Small asymptomatic polyps may not require treatment. Hysteroscopic polypectomy. Surgical removal of polyps using a hysteroscope. Hysterectomy. In some cases, hysterectomy may be necessary for women with recurrent polyps or other underlying conditions. Impact on fertility. Both fibroids and endometrial polyps can negatively impact fertility. Submucosal fibroids can obstruct the uterine cavity, making it difficult for sperm to reach the egg. Endometrial polyps can also interfere with implantation and pregnancy. However, the impact on fertility can vary depending on the size and location of the growth. In many cases, treatment can improve fertility outcomes. Long-term implications. While most fibroids and endometrial polyps are benign, there is a small risk that they may become cancerous. This risk is higher for endometrial polyps than for fibroids. Regular follow-up care is important to monitor for any changes in the growths and to detect any potential complications. In conclusion, Fibroids and endometrial polyps are distinct gynecological conditions that can affect women of reproductive age. While the shades share some similarities, they differ significantly in their composition, growth patterns, and clinical implications. Understanding the differences between these conditions is crucial for accurate diagnosis and appropriate treatment. By working closely with healthcare providers, women can manage these conditions effectively and improve their quality of life.